Hello to everybody, and thank you very much for joining this call. I am recording this conversation. My name is Artyom Les. My name is Artyom Les. I'm a media advisor and a media consultant. I work with Internews and with a number of other organizations. And one of my roles is a mentor of what we call, or in Internews, the Pandemic Mentor Bench. And one of the things we do on this bench is we talk to the media organizations around the world, really, about ways in which they can be covering the COVID pandemic in a matter which is both engaging, but also scientifically and academically correct. We have been doing it for about a year and a half, 2 years now, well, really ever since the pandemic began. And I'm really pleased to introduce this conversation, which is focused on the psychology of the acceptance of vaccines, or what some people describe as vaccine hesitancy, and also partly on how the landscape concerning COVID is changing because of the emergence of the Omicron variant of this disease. This conversation is being recorded. I will share the recording with everybody who's on this call later on. We will probably take about an hour and a half. And if anybody has any questions or thoughts or wants to jump in with any comments, then please just feel free to do so. If you want to put something in the chat, again, there's no need to wait until the end of the conversation. Just jump in whenever you like. But I'd like to start with introducing our panel, and we have some really, really amazing people today to talk to you. So on our panel, I'm really pleased to introduce the guests, Melanie Paul, who's a technical advisor on mental health and psychosocial support, works with the International Federation of Red Cross and Red Crescent. Andra Uzberg, who's the associate professor of affective psychology, University of Tartu, and also member of the Scientific Advisory Council to the government of Estonia. Frido Herrings, who's the COVID-19 operations coordinator with the Red Cross. Oleg Benesh, who's a senior immunization specialist with the World Health Organization. And we are waiting for one more guest to join us, Alexandra Arhipova, who's a medical anthropologist. I didn't even know that was a thing until I started preparing this conversation, but it sounds an amazing job title. Alexandra should be joining us shortly, and she may actually, oh, there she is. There she is. Hi, hello, Alexandra. And I really would like to start by asking each of our guests just to talk for literally 30 or 60 seconds, just to say a few very quick words about what to them is the main thing in which the COVID-19 landscape has changed because of Omicron as far as their field is concerned. So how did the emergence of this new variant and the renewed attention to COVID-19 among so many people who thought that the pandemic was over, how is that being reflected in what you do? I don't know which of you would like to start. Mel, I'm looking at you, so I'm going to volunteer you to start. I think you're on mute.
Should we start with someone medical to answer
Okay,
that
yes,
question?
absolutely.
Maybe, I'm not sure.
Oleg, do you want to start then?
Yeah, of course. Thanks so much, Artyom. And definitely when we speak about Omicron, first of all, the key concerns around this variant were driven by the magnitude of changes across the virus genome. And we know that they were documented from 45 to 52 amino acid changes, and also 26 to 32 changes in the spike antigen. So that itself definitely triggers a lot of concerns about how this virus with such a big change in its structure will behave. And aside that, also some preliminary findings that in South Africa in particular, we can see a resurge of infection caused by Omicron. And at this stage, the virus has been documented I think it's about 26 countries in European region and 31 countries in other WHO regions. So we can see that it's already quite spread out. So definitely from that perspective, we can see that it's a virus which it's already spreading out globally. There are some news which does not tell at this stage that this virus would behave in a more pathogenic manner, so it's not more severe. Even same data from South Africa shows that the percentage of hospitalization during the wave caused by this virus is actually lower as compared to other variants. So there are a lot of pros and cons at this stage to let's say to look at, and definitely there is a lot of ongoing discussion on it. On 6th of December, WHO has coordinated an global discussion on the topics on priorities of research driven by Omicron. What I would like really to highlight here is that definitely when we look at, at the potential of this virus to cause concern, that's one aspect. But we also need to take into account our capacity to respond at this stage and our lessons learned from previous stages of the pandemic. And when we assess the risk, I think that we need to look at both those two dimensions.
Well,
so
we'll get into that. We'll get into that in more detail. But I just want to very briefly ask Frido. So, from the perspective of how the Federation of Red Cross and Red Crescent Societies works, what has changed in recent months, if anything, for you?
Yeah, thanks very much, Artyom, for that question. I think you said, what does the Omicron virus bring and what is different? I'm afraid that from our perspective, from the operational perspective, we actually don't see a big difference. I think I'm looking at the European region as that's my focus area, and we continue to see that Europe continues to be the global epicenter of the pandemic with the fourth wave, fifth wave even. Cases have doubled in the last couple of months. So actually, we're not even seeing that decline in cases. I think there is some positive news as well. There is that positive news of the severity of the affected people and infected people, and that seems to be largely due to the vaccinations. But I think the conclusion for us is that this pandemic is far from over. We still have a long way to go, and we still have a lot of work to do, particularly in that. I guess I'm also looking at some of my colleagues here in that reaching out to people and convincing them that the pandemic is far from over, that they still need to maintain their social distance, that they still need to get tested, that they still need to get vaccinated, that they still need to be aware that we still have a long way to go. So for us, there is, it's far from over. Thanks.
Alexandra, Andrew, you study the way people talk to, each other and the way in which people talk about the pandemic. Have you noticed any changes in the last few weeks in terms of how people perceive what's going on around them, or is it more of the same? Sasha, I think you're muted.
Hi to everybody. Well, I can speak about the situation in Russia, and situation in Russia is tricky as usual. First of all, Russian state media just last several days use a bunch of doctors or medical workers saying that Omicron is nothing dangerous. It's a live vaccine. It's absolutely nothing dangerous. In opposite, independent analytics and independent people in analytics saying, which are quite famous, saying that Omicron is very dangerous. And we have a new now it's small, but it's grow a new wave of rumors and conspiracy explaining, look, that Omicron, it's also not dangerous. So in this part, this rumor is following Russian state media. It's not dangerous because it's a real coronavirus. And COVID-19 original one was an artificial coronavirus. And now we can see that the original nature virus is beating the artificial one. So very soon the life will be normal.
So this narrative, where does it exist? Is it something that exists in like social media when people talk to each other in their kitchens, or where does it exist?
Both ways. I recorded it directly from people who heard it at their job places, and also it's spreading quite fast in social media. But it's just started to spread.
So that's Russia. Andrew, what's happening in your part of the world?
Hello to everyone. So unfortunately, I don't have data yet on I'm a psychologist, and I'm mostly in my capacity as the advisor to the Estonian government. My main tool is a regular population-based survey, and I'm still waiting for the data. But I do have hypotheses or these observations, and I think for me, the moment in time is really interesting, and I think it's interesting because one of the key psychological dimensions that plays a role in the extent to which people experience the pandemic as stressful, and also to the extent that they are motivated to protect themselves and others, is the kind of the perceived causality of the ongoing situation. And what I mean by that is that we of course know that the ultimate cause of the situation is a biomedical organism, is the virus. But I do see in Estonia, and I believe it's true in many other countries as well, that in media frames, in everyday conversations, people can perceive the situation as being caused by the government, as being caused by the governmental response. So the focus shifts slightly to the way the government is handling the situation, whether the government is doing a good job or a bad job in controlling the virus, in getting people vaccinated, etc. And I do feel that at least in Estonia, the pendulum swung pretty much to the direction of really this pandemic dynamic becoming a dynamic between the people and the government, with the kind of the illusion as if the government is in total control of the situation, and everything that happens, good things happen, this is thanks to the government, bad things happen, this is because of the government's faults, and this fresh dose of uncertainty that the Omicron just kind of hammers home. We always knew that in the back of our minds, that we don't know whether it's over, there might be new variants, but this now hammers it home. And my hope is that this gives an opportunity to kind of take a step back from the illusion that it's not only about governmental response, it's really about how the government and the people together deal with an unpredictable threat.
Thank you. I want to talk a little bit more about what Omicron actually is. We'll talk about the governments and the narrative separately, but I want to talk a little bit more about the virus. And I want to ask both Oleg and Frido. Frido, you said that Europe was at the epicenter and has remained in the epicenter with all the subsequent waves for the last few months. Why is that? What's so special about Europe?
Yeah, I think maybe Oleg, you want to focus on that a little bit more, what the medical reasons or the health reasons are behind that. Maybe you can allude on that.
Yeah, first I would like to highlight that the situation varies a lot across the region, and the underlying factors which stay behind the surge of infection may vary as well. For example, we have quite a number of countries, in particular in the middle income group, but also some high income group, which achieved just a very average level of vaccine uptake of about 50% or around. And then you have like a very large proportion of vulnerable population in those countries. It's more than that. When we are looking at how well these countries have protected most vulnerable, and in particular elderly groups. We have a big problem across the region with this issue. When we looked at who is getting hospitalized, who are in ICU, who are dying, so more than 85% of those people are really unvaccinated and are elderly and are belonging to these highly vulnerable groups. So that's one side. Then we may have situations which are a little bit different in countries which manage to reach a higher vaccination uptake. And here we can see more cases in younger age groups, in particular school children, students. Where we may have a little bit of different, let's say, underlying causes. And here there is a lot of discussion now about waning immunity, about the need for booster doses. But again, I think that we really need to be careful to specific countries' context. Because the way how this pandemic evolves, the impact of resurgence of infection is very different. We can see countries with very high number of new cases, but very low hospitalization and very low number of deaths. And those are in particular countries which manage to protect those vulnerable groups, to have very high coverage. And we know that vaccines work, and we know that they protect from severe disease and deaths. And then we have the situation very different in other countries.
So you said, you just said that we know that the vaccines work, and you spoke about the level of vaccination. But then with Omicron, there's quite a lot of confusion about whether vaccines actually do work. I saw something this morning that suggested that a third shot of Pfizer might be useful. I saw other versions of the same news, which basically said, no, it's not. Do we know for sure?
I don't think that at this stage we have really good data to support a decision. But when we look at at what we have learned from previous variants, we have seen that while effectiveness of vaccines on protecting from severe disease and deaths was maintained, we could see a decreasing trend in protecting from transmission against variants. And in particular, when we speak about Delta variant, the level of protection is the lowest. So, and then we also saw some evidence from countries which, let's say, indicate towards the role of booster doses in reducing that transmission with the new variants. So we don't know exactly how things will happen with Omicron, but at least we know what has happened so far. Of course, we learned from this also declaration from Pfizer management on the ongoing research, which is very encouraging on their side. But we will have to learn more in the coming weeks from other manufacturers as well.
Here in Britain,
people...
Sorry, of course, yes, please go in, yes.
I just want to add on that. I think that what my colleague here from WHO is clearly pointing out is that there is indeed, there's still a lot of research needed, and there's still a lot of efficacy trials needed to show that the vaccine actually works. I think that is part of the, if I may call it, the solution. But I think what we're seeing in the Red Cross is that it's not just about the vaccination and about getting the vaccines in those arms. It is about the total package. It is about the social distancing. It is about the testing. It is about the tracing. It is about making people aware, and it is about making the right information available to people. And I think my colleague Mel can allude to that. But I think we have a very serious situation where there's still a lot of widespread misinformation. There's this hesitancy, and I think what for us is really an important reflection as the Red Cross and Red Crescent is that we take those fears and those worries as legitimate, because that is what people have, and we need to deal with that. And we must treat it as such, and we must sort of build the trust with them to make sure that they are able to take their own decisions in this wider package of addressing the virus and the pandemic. But Mel, maybe you want to allude to that a bit further.
I think we'll come to that very shortly. I just want to raise another point about the boosters and about the vaccination, which is when the rollout of the vaccines was beginning, a year ago now, we spoke quite a lot about vaccine nationalism and about how some countries were vaccinating their population much more rapidly than other countries. And that was one of the big issues for the WHO at the time. And I had a conversation here in Britain on the radio the other day where somebody called into the program and said, should I refuse my booster so that my jab can go to somebody in a poorer country who may need it more than I do? Is there an answer to that? Should, on the bigger scale, on the global scale, should we be refusing our boosters so that the vaccines can go to poorer countries?
If I may, Artyom, to comment on this, we definitely saw over the last 11 months a big change in terms of access to status of access to vaccines. We had a situation yearly during this year, then access has been improving over the, let's say, second and third quarter. And then when we ran into the fourth quarter of this year and for the next year, we can see that quite a number of countries now are struggling hard to absorb the vaccines which they got in their hands.
So there's more vaccines than can be developed,
yeah,
right?
I would say the issue now is not just lack of vaccine. It's much more complex. It's how to get those vaccines into the right arms.
Well, let's talk about that a little bit more. And this is where I wanted to come to Alexandra and to Andro. So what sort of perceptions are you seeing in terms of vaccination? I know that you, Alexandra, did quite a lot of research about the link between, or the perceived link between vaccination and the elites, and about how people perceive themselves as perhaps weaker and perhaps being forced by the elite to do something they don't want to do. Is that something that plays into this whole conversation, Alexandra?
Well, this is basically, this is a this feeling that elite is pressuring people and forcing them to do something that they didn't want, they didn't need, or this is a secret plan to kill poor population. It's a main reason for current protests. It's a risky business now to protest in Russia, because while you're going to streets, you can be punished, and you are going to be punished under several very severe laws, but that we should remember it. But still, there is like there were 258 different types of actions, and basically all of them happened last 2 months. So it's a lot.
I know that
in Siberia and Ural Mountains.
Well, there was this notable case, wasn't there, in the Far East, where the entire staff of an ambulance station resigned rather than get vaccinated, and the whole region in the Far East of Russia was left without any ambulance cover whatsoever for a period of time. But Andro, is that something that plays out in your part of the world as well, this mistrust of governments feeding through into mistrust of vaccination as a drive?
Yes, it does. I would paint a short picture or a sketch of kind of reaching a decision about vaccination, and then we can use that sketch to understand where kind of vaccine hesitancy can stem from. And I would say that there are, to oversimplify a little bit, that there are two dimensions. There is a cognitive dimension, and then there is this kind of motivated dimension. And the cognitive, by the cognitive dimension, I mean, what I mean is that in essence, the decision can be reached in a rational way. And if you'd approach the vaccination decision in a rational way, you would end up weighing, the expected benefits of vaccination and the expected costs of vaccination against the expected benefits of non-vaccination and then the expected costs. So it comes down to, essentially a race between my perception of how bad COVID is and how bad the side effects are. And the problem, the cognitive problem, is that first of all, the task is not something that the human mind is well suited, because it involves computing, relative probabilities, and therefore, we use a bunch of kind of tricks or heuristics. So we reach for easier ways to estimate these probabilities. And when I'm using these terms, estimate probability and compute relative probabilities, I don't mean that we would do that consciously and explicitly. What I do mean is that the mind is trying to approximate these computations, and in that process, the mind is using various kind of shortcuts. And now, given that the task is complex, the mind is reaching for these heuristics, and some of these heuristics that usually work in the vaccine context fail. So, for instance, one very common heuristic is to essentially infer that if I hear something being talked about a lot, it must represent the probability of that something happening. And now, if you look at the media coverage of side effects and compare that to the media coverage of serious consequences of COVID, then in very rough estimates in the Estonian data, what I've seen is that for every case of hospitalization with vaccine side effect, there are about 200 cases of hospitalization with COVID. And now, if we were to ask, if I'm opening up a news outlet, do I see 200 stories about COVID patients for every story about a vaccine side effect? No, I don't. At best, they are with equal probability.
But as a journalist here, Andrew, I would say that from day one, when you start working as a journalist, from day one, you're taught that your job is not to cover stories where a dog bit a man, it's to cover stories where a man bit a dog.
That's the thing. And I am aware of some of the mechanics that make the journalistic profession tick. And I'm not naive, that naive to think that the job of a journalist would be to always paint probabilistically accurate picture. But I do think that there is room for making sure that your story has the required context. So even if there is a portrait of a side effect, and there should be a portrait of a side effect, I'm not advocating hiding anything, that this relative probability can be painted there. So this is the cognitive problem, that the task is difficult and the heuristics I'm usually using might fail me. And then on top of that, we have this kind of motivational dimension, or that very quickly becomes a social dimension. And again, we can begin with the kind of the cognitive problem that, in many cases, when we're faced with such a difficult cognitive task, what we do is that we follow others. And this is completely rational. This is totally normal. We don't expect everyone to make personal, highly considered decisions in a complex field like vaccines and medicine. And now the question becomes, whom do I trust? And this is where, and I especially like the term elite here. So it's not only about trusting the government. What I see in Estonian data is that people who are hesitant about vaccination, it's not only about not trusting the government. It's more about feeling left out of the mainstream of the society. So I might not trust the mainstream media. I might not trust companies. And the distrust, I think it would be a mistake to imagine that this distrust always manifests in these almost laughable conspiracy theories. This is there as well, but it can be much more reasonable. that you just feel that the companies, that they are out for themselves. You feel that the media is getting, yellow, trashy. I don't find intellectuals, so people who feel that kind of the train where kind of the mainstream of the society is on the train, that this train is leaving them behind. We now find that they are more hesitant about vaccination, and I do believe one of the mechanisms is that now they are being asked to trust members of the mainstream in a question that is very complex for them, and this mistrust that they have that can vary in degrees makes them hesitant. So this is the sketch.
Alexandra, Antero mentioned the word conspiracy theories. How do they actually form? What's the mechanism there?
It's a tricky question, because sort of conspiracy thinking has almost every person on the planet. That's the point. But a lot of psychological experience show us that in this, if you put a person in special stress, if you depress him or her somehow, make him anxious, then in this situation he respond better for conspiracy theories.
So basically, the stress of COVID makes people more susceptible to these sort of theories.
Yeah. Mm-hmm.
Yeah.
And also, we should remember that it's a very easy and simple way to explain things, because our brain want answers, and to get answers from science data for anybody outside science is not that easy. And conspiracy thinking is giving you simple and very quick answers. That's always in the short period of time. Conspiracy is always winning.
Let me ask you both: can conspiracy theories? Is there a vaccine against conspiracy theories?
Interestingly, there is evidence that out of the things you can do, prevention is the one that's most effective. And what I mean by prevention in this context is that you educate people about some of the kind of the structures of conspiracy theories, and also get them into the habit of analyzing the motivation of information sources. So this is really about media literacy and kind of media hygiene, and this can be effective. Unfortunately, there's a lot of evidence that once the conspiracy theories or I think there are two levels. One is individual level. So once the individual is really prone to conspiratorial thinking, it's quite difficult to change that. Debating that person isn't really helpful. There is some hope in kind of finding common ground in terms of values and emotions. And on a societal level, also, if a question is highly polarized, then it might be the best to wait it out and avoid kind of polarizing it further. But I'm curious what other people have to add to that.
I just want to pick up on something you just said, Andrew, and ask Alexandra. So you said something about the polarization, and Alexandra, I know that's something you are seeing in your research, the way people talk to each other, the way people who are, and I know this is simplistic, the way people who are pro-vaccination and anti-vaccination, how do they talk to each other? How do they refer to each other?
They use a lot of so-called register. Both of them invent their own register of language, special type of language, quite emotional, especially from the side of anti-vaxxers. And they invent a lot of words showing that all these vaccination process, people who get vaccinated, it's non-human. So they transformed into robots, into aliens, into something that is not human. And this is like a basic linguistic feature of these new words. which appeared again and again just now. And this language is quite emotional. They use it all the time, and also they use it. They use these words with hashtags to unite through internet. So it's quite powerful.
So that's people who are against vaccines. What about the people on the other side of the divide? How do they talk about people who are vaccine hesitant?
Well, they use another type of language. They prefer to construct words which show world that urbi et orbi, that I'm normal guy, and those who don't like vaccine, they're crazy people. So they use a position normal and abnormal. So like they're calling the opponents anti-vaxxers, anti-vaccinators, well, in Russian you can say beskwarnik, so person without QR codes and something like that.
Melanie, I want to bring you in here because you've put together this training course on essentially how to talk to people who are vaccine hesitant. Could you summarize the main thoughts from that for us?
Yeah, I think it goes back to your question, is there an antidote against vaccine hesitancy? And I think this training package has tried to take that research like that my colleagues have been working on as well, and bring it down to something that's quite accessible, and teach people the tools to do that, to work with this issue of vaccine hesitancy. So how this training package came about, that the reference hearing some over and vaccine indeed global issue. We were hearing that hesitancy was very strong, and that our staff and volunteers didn't have good tools to work with this issue of vaccine hesitancy in a constructive way. There was a lot of us and them, that language that you're talking about. So the latest global research and the latest evidence on vaccine hesitancy and conspiratorial thinking, and what works to engage in an effective and positive way with people who are experiencing hesitancy. And so what the aim of the training is that we are wanting to promote people's well-being. We are not necessarily wanting to promote people to get vaccinated per se. That is not the goal of the training at all. The goal is to engage with people. And it came up in the discussion before, something that someone mentioned, the additional stress, and also being quite isolated can lead people more into conspiratorial thinking and being harder to come out of that conspiratorial thinking. So the training is to reconnect with people, or to connect with people, to talk about in a constructive way their fears and worries, to find out what it is that's actually concerning them about the vaccination, so that the person assisting can work with that. So what's inside the package is it goes over what vaccine hesitancy is, just in quite plain language. It explains for the person taking the training why vaccine hesitancy occurs from quite a scientific perspective, like different modules, which our colleague was
which Andrea was just describing. Yeah,
exactly, like the social processes and the cognitive process, as well as structural and barriers, etc., to getting vaccinated. Essentially the motivations that drive vaccinations. The training also talks about the type of resistance to vaccines that is common, and it encourages the person taking the training, and who will be later working with the issue of vaccine hesitancy, to think about the cultural context that they're working in and the population they're working in. And it provides guidance not only on how to interact in a helpful and positive way, but also tips on kind of things to avoid, which would be that language that was mentioning of othering people and this highly emotive language. And and it gives like a series of tips as well on how to engage.
Who are the people taking the course?
So we released the training kind of mid-year on our website platform, only in English, and straight away our national societies, because we just wanted to put it out there before we all took summer leave and we didn't have time to translate, and straight away that was picked up by our Asia Pacific office, who ran it across the Asia Pacific and translated that into a range of languages there. It's been translated into Georgian and run within the community here. I think I might even be able to see the translator on the call. And it's also been translated into Spanish, and it's been run in the Caribbean, the Caucasus, a range of places, and Africa very much. So the package has been rolled out there as well. So that's the staff and volunteers of the Red Cross, Red Crescent in particular. We have around, Frida will correct me, around 60 million volunteers. So we're hoping that many of those will take that up. And importantly, they're embedded in communities and working with people. And not only that, it's not only who the Red Cross, Red Crescent might work with in kind of a client-based way, but also our own families who may be having hesitancy, and that may be creating tensions within our own homes, within our church communities, within other communities, so that we can have more positive and constructive conversations with people that is not creating this tension. I mean, and we've seen it in the media, like heightened tensions, violence, these types of things. Even if people were not getting vaccinated, if we could bring down that level of aggression and violence towards healthcare workers and others, this would be an amazing step forward.
Frida, can I bring you in here for a second? So Melanie just said something that I found really concerning. She said there was a level of aggression and violence towards healthcare workers. Is this something you recognize? Is this something maybe you, Oleg, as well, you want to comment?
I think that is indeed something that I think what we need to reflect here is that indeed the dominant aggression has been towards particularly the healthcare workers that are government or state functions. And I think in what we're seeing in our work with our volunteers is that we're very careful about the trust relationship that we have. So, you know, if your neighbor comes up to you and says, listen, I have been made to understand that you are not willing to wash your hands and you're not willing to get tested. But I actually, as a Red Cross volunteer, I'm recommending to you that, you know, it might be a good idea to do that. And while you're at it, maybe get vaccinated as well. You are much more inclined to believe your neighbor because that's a person you trust. And so in that sense, I think we are very much looking at that trust relationship, and that luckily for us, although not always, does give us better access. And through that, we are also able to avoid some of that aggression that might be out there towards ambulance workers and these kinds of things.
It's interesting you would say that, because it plays into what Andor and Alexandra were saying about different levels of trust towards somebody with, you know, who is your neighbor, who lives in the same community as you do, and perhaps to somebody who flies in the helicopter and, you know, wears a nice white coat.
Well, I think I think that's one of the reasons why we are being, as the Red Cross and Red Crescent, we get quite a lot of acknowledgement, not only from communities, but also from authorities and government. I mean, the Red Cross volunteer network across the globe, but definitely also in Europe, are the tentacles into the communities. And especially in a pandemic like this, you'll see that health authorities have difficulty reaching those hard to reach areas, those difficult communities, let's say. So the Red Cross, Red Crescent can play a crucial role in that. But of course, we need to be also careful that we don't become part of that, what colleagues have said here about that polarized world, that we are still out there. And of course, we are telling people that it is wise to get vaccinated, and we are telling people it is wise to get tested and to wash your hands and all of those things. But we do need to make sure that message is coming across on a trust basis, and we do listen as well. And we want to acknowledge the fact that if there is that hesitancy out there, that is a realistic fear that people have, and we need to engage with people to make sure that we get our message across and don't feed the polarization, let's say.
Andrew, I was about to ask.
I just wanted to add this this nuance here that this is borne out in research and also in the Estonian experience, that we can, you know, rank different institutions in terms of trust. And the medical profession, you know, defined broadly, fares, you know, relatively well. So even if we do have this problem that the medical professional can come off as condescending and distant, we do see that there are other institutions like governments that are even more mistrusted, and we do see that. And I think it depends on the countries and regions. I think Estonia is fortunate that the trust between a patient and, in particular, their own, we call them family doctors or primary care physicians, that this is a valuable relationship. And for a while now, basically the main channel that still produces new vaccinations is through this network of primary care physicians. So I think there are basically two dimensions. One is this distance in geographical, but even more so social sense, that my neighbor or my neighbor in a social media network, neighbor in terms of shared values, shared interests, but also there is still value in expertise and in kind of unpolitical pure expertise.
Melanie, I want to come back to you and think about the way in which journalists operate for a second. I know we've touched on it, but if I were to write a piece about, the vaccination effort, what are some of the things that I perhaps should not be saying in it? What are some of the things that, on the basis of your training course, can remove this element of trust and can actually make more harm than good?
Perhaps I'll phrase it in the positive so that you know what to do. And you can just put it in your mind in the negative if you prefer, but I would rather give you the directive on how to do it, if you don't mind. So what I would say is to go back to actually the things that my colleagues have already mentioned, which is to find common ground in your article. So if you want to write the story about the man that bit the dog, that's fine. If you want to write about vaccine hesitancy, great. But find common ground when you do that. Go get someone who's vaccine hesitant and interview them. Now the vaccine hesitant person is listening to that story because you're using someone who has that common ground. Have a wide variety of people on your media team from different backgrounds, because as we heard, people who are vaccine hesitant come from all walks of life. So get someone they can resonate with. In your stories, why not cover those social influencers, those doctors, those neighbors, those people that have an influence, and show them getting vaccinated so that someone has that, who is vaccine hesitant, has a role model to look to who they relate to. So find common ground. That would be my first suggestion in your stories. And you might want to open it. You can open it with a sensationalized heading if you like, but also talk about very early on in the story how it's normal to be hesitant to things that are new. Now the vaccine hesitant person is interested. Oh, I'm normal. Are you saying I'm normal? That's the first time I'm hearing this. I'm going to read the rest of the story. And it is normal. It's very normal to be hesitant to things that are new, to be hesitant to things that have a lot of uncertainties about them, and to be hesitant about things that can have a large impact on our safety. And that is the COVID-19 pandemic, and that is the COVID-19 vaccine. So start off your stories with something that's true and draws people in and finds common ground. Then I'd say in your stories, of course, be open, polite, honest, respectful in the engagement. Don't use that us and them. Don't use that you can use the highly emotive language, but use it in a really effective way. Because when we are more respectful of alternative views or of other people's views, this allows people to feel less stressed. And when we're less stressed, we can more openly engage with information that we're presented. Make the stories, as you know, like a nice length for people to read, because when we're highly stressed, we can't get through a lot of content. Have the links to the accurate information. Present the stories in a highly accessible way. So thinking about language, thinking about phrasing, thinking about, just links to trusted sources, and think about what sources are trusted in that particular audience you're reaching for. And as was mentioned, in some cases it will be, the CDC, in some cases it will be the family doctor, in some cases it will be the government, and in some cases these will be the less trusted sources. So find the sources that match with the audience to send the message that you want to about vaccination. Also, As was mentioned, like a lot of concerns can be quite localized, and we've found that in the Asia Pacific region, we've actually started collecting lists of what are the primary concerns that people have in different regions and countries and groups, and we're distributing that to our staff and volunteers so that they can already prep themselves with some knowledge about what the fears are and have some useful information available to people. So tailor your stories to your audience and validate those genuine concerns that people have, because there are some things that we should all be, or that are genuine concerns given, you know, a particular health issue you might have, or age, or etc. So validate genuine concerns. We'll also draw your reader in. They'll be interested to read the rest of the story. Again, less stressed, more open to that new information. And I think also, don't be afraid to identify misinformation. If you see that there is a rumor going around that is false, that is a rumor, it is fine to address it in the story. But do this in a respectful way. Again, people will then be more likely to read it. And what vaccine hesitant people need, kind of what's missing in their information, or what information is useful to them, is something that they might be missing in their information, something that provides a little more perspective. I think it was mentioned that some views might be a bit crazy, so even like or seen as crazy. So maybe like a list of different vaccine hesitant views or reasons why, and then people can see the list and be like, well, that particular one is pretty far out. So I can see that some people in this group are maybe more extreme than I am. And also, you know, always providing that link to reputable sources of information. And I think perhaps one of the most important things is you want your audience to keep coming back again and again and again. Of course you do, you know, you're a journalist. This is how your media works. So don't take highly offensive positions on things, even if you feel you might be in the right. It's better to take a neutral stance, give two stories if you need to do them separately. But mostly the reason for doing that with vaccine hesitancy is not just to get people coming back, but it's so that if they do want to step back from their views, they don't have to be highly embarrassed by it. You know, when people are, let's say, very strongly into conspiratorial views, they might become quite isolated or more strongly bound to the community that also has conspiratorial views. So if they remove themselves from that, they may be found quite isolated. So they're going to need all the support they can to move forward and reintegrate with another social group. So there's just so many things that we can do in the way that we communicate information that can really increase the uptake of vaccines.
Thank you, Mel. This is really handy. And I just want to very quickly ask Alexandra, and I want to ask you this, Alexandra. There were quite a lot of things which Mel said, which were examples of how the media could perhaps be helpful in bridging this divide. I know that your job is not necessarily to bridge the divide. Your job is to measure things and record them and say, this is what's happening. What are you seeing in terms of how people respond to media, people in both camps? How does the media work play into their perceptions?
I have the idea that like there is a secret agent of FSB is listening to us, and they're doing absolutely opposite what just Melanie said. Because now we have a very high level in November, where we had a very high level of death rates, a very extremely high level of infection rates, and media, state media started to polarize people as much as possible. So it's quite opposite Melanie's advice. Absolutely, in official state media and official media personas, they start to call people who hesitate about vaccination stupid, fools, crazy, with less cognitive abilities, and so on and so on and so on. So of course, people respond to it with a high level of protesting and refusing vaccination. And also, I would like to mention about negative response to doctors. It happens in many countries, and I should mention, as an anthropologist, it happened before. Unfortunately, it's a normal thing. In the moment when some epidemic starts, usually it happens. The nearest health workers are considered to be the threat and the source of infection. Unfortunately, that's how it's working.
Is there anything that can be done about it, or is that just something that we need to accept and move on?
Do you have another humanity around? It's too long with this. It's a really long process. It's nothing like it can be changed like in 5 minutes.
I want to start wrapping up slowly, and I just want to ask you this. If there was one thing from your perspective, and I will ask each of you, if there was one thing from your perspective that we as the community, as the humanity, as Alexandra just said, could be doing differently to make people more open to vaccination, what is that one thing? Melanie, what is the one thing we should be doing differently, you think, to make people more acceptable, more accepting of vaccinations?
I think everyone should take the training from the IFRC Reference Center for Psychosocial Support and learn
Nice plug.
the technique. I think just learning the techniques to treat people with respect and dignity for the choices that they want to make about their bodies. This is an individual choice, and the more we take a self-righteous view, the more hardline people are likely to get. So a softening on the side of the pro-vaccines to understand the perspective of others, I think, can bring us everyone closer together.
Thank you. Frido, from your perspective, what's the one thing we should be doing differently?
I think what is important, indeed, as Mel said, non-sensational, non-polarizing, but I think also give the complete picture and provide that facts and science-based information.
Andra, you work with governments as well, with the Estonian government as a scientific advisor, and I'm going to ask you this: what's the one thing that governments should be doing differently to what they're doing now?
Yeah, I have two things, but they do relate to two kind of allures or attractions that are hard to resist, but we should resist. And one of them is what I started with, and this is the attraction of seeming more in control than we actually are. And by we now I mean people in positions of power, may they be governments or medical authorities, so that we it does feel good if I'm in a position where I can kind of soothe people. I can say that I know what's going to come. Here's how we will combat that. And there is definitely need for more predictability, but that doesn't mean that I'm oversimplifying and overpromising. So this is a difficult balancing act to communicate honestly about the outlook, so that I do increase kind of the predictability. I do lay out different scenarios, but I don't pretend that I'm I have more control than I do have. So this is one of the kind of the temptations that I think people in power have and should resist. And the other is to paint bad news in a slightly rosy colors. So there's definitely no manipulation of data or hiding of the facts in Estonia or in any other democracy. But what I do see hints of is framing the first news about serious side effects, communicating the news with a preference that yes, there was a unfortunate event, but the person was very ill anyway. So really sticking to your making the goal of being absolutely transparent, and then sticking to that not only in facts but also in tone. So the tone is really neutral as well. So these two kind of temptations that I think it's very, very human to kind of fall to them when you're in a position of power. But I think in the long term, when you can avoid both, you will maintain and build trust. And as we've seen, this is the main thing you need in the long run.
Oleg, from WHO's perspective, what needs to change to make vaccination more accepted, and what needs to change specifically now that Omicron is working its way through Europe?
Yeah, from WHO side, when we look at the people who have not yet received the vaccines, we try to understand really what is behind that situation. Because in some cases, we definitely may see concerns. In some cases, we may see so-called hesitance. But we also have documented so many situations that the source of the problem actually is on another side, is on the side of service delivery, is on the side of engaging partners to work together as a community, on the side of being transparent to the public and try to build this confidence by being open about both, let's say, benefits and risks. So that's, I think that would be a message from this side. Let us try to really to focus on potential issues, both on demand side, but also on supply side of services. It was very interesting with recent experience when in one country in Central Europe, pharmacist says, we feel like out of the picture. We are not part of the COVID response. And they felt like a responsibility because they are in touch with people on daily basis through a wide network. In another country, having like just less than half of family doctors engaged in COVID response. So there are so many other factors behind unvaccinated people or false contraindications when people just follow some outdated practices or policies. So I would say we really need also to try to identify these issues which require action and require engagement, because we can bring a change here. And we saw these examples in countries. For example, we had like 2 countries in recent times which changed the service delivery strategy, and the vaccine uptake just went up. Or a country which changed the policy in terms of vaccinating elderly people and people with comorbidities. So that would be the message. Let us keep, let's say, all the moving parts of this complex picture and try to address them in a specific manner.
Thank you, Oleg. Before we come to the questions, I just want to take this opportunity for a plug. And the plug is directed at the journalists on this call. Internews and the Sabin Institute is launching together a grant program which will assist journalists in Eastern Europe primarily, but also in other countries in the region in covering vaccine-related issues. We will be sending out the call for proposals and the application form, which we'll want you to fill in shortly. But please know that this program is, we're hoping that it will cover quite a few months, probably 2 or 3 months, and we will assist you in creating stories about vaccines and how they work and the vaccination, both in terms of grants, but also in terms of mentorship and support and consultancy. So that's the plug. If anybody wants to hear more, then please feel free to contact me. People who signed up to the Zoom call should have my email details. If not, then I'll share them again later at the end of the call. But I now want to ask the audience, and I want to ask the people who are on this call whether they have any questions to our panel. And if you do, then please just jump right in. No need to type anything in the chat.
Artyom, this is Jaya.
Hi, Jaya.
Yeah, and this is addressed to anyone who cares to answer it. And I just wanted to get a handle on how to report on mandatory vaccination. What really are the issues that journalists should be flagging up? Should we be promoting hybrid vaccination strategies? I mean, for mandatory vaccination? Thanks.
I can open the floor because I don't want to address this question, but I can address. I want to share a case study from Estonia about mask mandates, and there might be a lesson there. What I was a little bit concerned about the media discourse around mask mandates when they were first introduced was the excessive focus on implementing the mandate. So somehow the media discourse in Estonia really focused on how this will be enforced. Whether there will be policemen on every door or just 2 doors, and what would be the budget of that, and that overshadowed the actual arguments for and against wearing masks and requiring everyone to do that, and what would be the expected benefits of if yes, a small proportion of the population would do that. And I think there is a threat in the vaccine mandates to fall in the same trap. That I think the key is weighing pros and cons of vaccination and mandatory vaccination, and the enforcement should remain just a part of the story.
Thanks, Andrew. Anybody else?
Artyom, it's Ida. I also have a question.
Go ahead.
Great. I'm not from the region and very non-familiar with the region. And so that's where my question comes from. For those of us not familiar with the region, I want to say that perhaps in the rest of the world, there's almost a narrative, as we've actually been discussing, that it's the most hesitant region in the world. There's the most skepticism. And Mel, it was fantastic to hear about your training because it's obviously so much needed. I really, really loved that. I wanted to ask those from the region, specifically working in the health and medical field, if you feel this description is fair. If it is it too stereotyping? And perhaps to also just say, are you aware of examples where there have been really great shifts towards confidence in vaccines and towards trust in the science? Because I think if there are such stories, they need to be told as well.
This silence is rather ominous, I think.
And the region is, of course, a massive, I realize that, but so I'm sorry, it's a very broad question.
I think that this is a very important and complex question. What I would like to highlight is that we definitely can see very clearly in a group of countries which have been very transparent with their communities, with populations, on both benefits and risks related to vaccination, that they have managed to maintain a good level of confidence and trust, and they reached a high level uptake, which shows clearly that you can be both transparent, you can be able to speak about difficult issues, such as risks related to vaccines and vaccination, and you can succeed if you really build the trust between two sides. Now, there are definitely a lot of other factors which will influence the results of this discussion. We can see political contexts, we can see other type of contexts which would impact that level of discussion. from WHO side, we definitely work a lot on promoting more transparency around the vaccine safety, around benefits and risks related to vaccination. But again, it's not an easy task, because it's also you need to overcome cultural aspects on, on whether in a country or in a context they are used to speak about this or they are not used to speak about this. So from that point of view, like having such a dramatic change, maybe I won't be able to bring now exactly an example, but what I really want to say is that we could see now quite a lot of countries being much more active, both in terms of medical communities, but also people to report on vaccine safety issues, to communicate about this, and that brings some hopes that we really build a way towards reaching this common goal.
Thank you, Oleg. Mel.
Yeah, maybe in response to the question, how do I feel about labeling this region the most vaccine hesitant, and is that a fair assessment? I think it's a dramatic oversimplification, because we have not asked every person on the planet if they're vaccine hesitant or not. As was mentioned by our World Health colleague, there are quite a range of reasons why people don't get vaccinated, and that can come down to access reasons, that can come down to a very strong hesitancy or light hesitancy. People who are hesitant still get vaccinated as well, because hesitancy is about a delay in acceptance of getting vaccinated as well, if we go back to the technical term. Yeah. So I find it's a gross oversimplification to say one country has higher hesitancy rates than somewhere else. But as was mentioned, it's human heuristics that we do like to simplify things and put banners on them. So I probably wouldn't I wouldn't label one as more hesitant as the other. Why not just work on the issue of hesitancy, but through the reporting that we do on the issues, and try and increase the rates, because I mean, as the slogan goes, we're not safe till we're all safe. And so let's spread our efforts everywhere and not go with that language of us and them, which we know is not helpful. And then I wanted to make a small comment about reporting on mandatory vaccination. I would say from the perspective of the Red Cross, Red Crescent, we feel it's very important that people's dignity and rights are respected over matters that concern their body. So then I would, and we are also within the movement, we support measures to keep people safe, and we support people having a say in their own choices. So I think if you want to report responsibly on this issue, it's good to raise both sides of the coin. And I would say responsible reporting would be to report on both of the perspectives about mandatory vaccination. Certainly it can increase numbers. Certainly it can further ostracize people within a society where they're no longer able to participate. Their children are no longer able to attend school if they have to be mandatory vaccinated and the parents make that choice for them. The parents can no longer enter the workforce, which can lead to a spiral of poverty. So they can be extremely negative from forced or mandatory vaccination, and extremely positive as well. So just report on both sides of the coin would be my suggestion to you.
Thank you. I think we have time for one more question. Anybody? What about mandatory vaccination? I suppose you meant vaccination, not tax, Jaya. Jaya's asking, what about mandatory vaccination for health workers? Facts. Okay, I think I'm now confused, but let's go with vaccination. Let's assume you meant vaccination. What about that, Oleg? I think it's something that perhaps you might have something to say on. Does the WHO have a position on this? Should health workers be mandatorily vaccinated?
Yeah, when it comes to mandatory vaccination, WHO there is, let's say, this should be part of the dialogue at the country level. This should be, this topic should be seen as part of the general discussion, but probably it won't replace the need to build trust and to build confidence and to share responsibilities and to act jointly as a community. We have observed from WHO side, when we look backwards at routine vaccination, that having mandatory vaccination worked in some instances, and it didn't work in other instances. So it's not going to work just by having like a mandatory decision taken. So that's the key message from this side. I think that we still need to do the hard work on building confidence and trying to, let's say, to act jointly as a community. Who is responsible for managing a crisis? Who is responsible for health or for well-being?
Tonya, you're asking if somebody could share a link to the training which Mel mentioned. Mel, I don't know if you have it to hand and if you can put it in the chat. I assume that means you do. I just want to add that through Internews' Health Journalism Network, we will probably also share this link, and that will be available to all the journalists who may be or may not be on this call. I just want to wrap up by saying thank you to everybody who took part. Thank you for all your thoughts. The recording of this conversation will be made available to journalists across the region. And as I mentioned, if anybody wants to apply for those grants for the vaccine coverage or for the coverage of vaccine-related stories, which Internews is rolling out together with the Sabin Institute, then that can be done if you email either myself on this email address or through the Health Journalism Network. And I just want to say thank you very much again to everybody who took part. Have a lovely rest of the day. I don't know, depending on which time zones you're in, you may be just starting the day, you may be ending your day, but whatever it is, please have a very successful and a very healthy day, and I'll talk to you later. And some of you, indeed, I will see again on the 13th, when we'll do a reprise with a slight twist, but in the Russian language. Thanks very much, everybody. Bye-bye.